Hello, friends. Many of my friends, juniors, and beginners of homeopathy practice ask me about methods of my prescribing. They ask me about my approach while prescribing medicine to a patient. They have many questions about bedside prescribing, prescribing in chronic diseases, role of constitutional medicine in treating chronic cases, as they find it difficult to reach a single drug and prescribe it confidently, avoiding any kind of confusion. So this month, on the occasion of birth anniversary of our master, Dr. Samuel Henneman, I have decided to share my experiences with you in a video of three parts. It will be helpful for those who are beginners and those who are facing difficulties in homeopathy practice. As we all see, homeopaths achieve their knowledge through learning through various materia medica, through organon, and attending various seminars. However, when it comes to actual prescribing to a patient in their own clinic, they mostly make mistake in prescribing that leads to failure in a case. Constant failure in prescribing leads to frustration as the practice won't grow as it expected to be. As we all know, in homeopathy practice, patients very rarely gives us a second chance. If they don't get relief in first consultation, they don't return back to you to give a second chance to correct your remedy. I have experienced similar difficulties in the start of my career as a homeopath. I had faced many failures. I was very frustrated with my failures. I would like to share with you how I evolved in my practice over the years. I like to learn from my personal experiences by actually trying it by myself, not from just book or from someone else's experience. How does this help me? Many of my failure helped me to become a confident prescriber. Learning something from your own experiences will help you to remember it for a life. For example, when a middle-aged woman complained me about her acidity, now I do not just think of drugs like arsenic, naxomica, lycopodium, or for that matter, nitram phos for that. I have tried these drugs based on the symptom similarity, and they have failed most of the time, as the cause of acidity in middle-aged women might be due to her menopause. So now I know she might need a drug like lacasis, sepia, simicifuga to cure her acid dyspepsia completely. This is because I have treated the cause. From such experiences, now I know how it is important to ask the patient about her menstrual history, even you are treating her for her digestive complaints. I have seen how Naxomica is a leading remedy in a disease that are brought on after an overindulgence of alcohol. I have witnessed how does nitram sulf work excellently in cases of extensive head injuries by treating many cases of head injuries. Throughout my early days of practice, I experimented with various ways of prescribing of homeopathy drugs. I experimented with various drugs by prescribing them on peculiar characteristic symptoms. Now I know exactly what homeopathy medicine needed to any particular illness, presented illness, and exactly what potency and how many repetitions of those will help the patient to overcome their disease state and make a full recovery. I can now prescribe confidently where I can avoid confusion on the bedside of patient. Dr. Henneman also advises us to not to accept anything without proving it on yourself. I have discovered one of the most effective and the most important part while prescribing in chronic diseases is to understand the various constitutional types of the patient. By learning and understanding constitutional characters of the many drugs, this is done by observing the patient and completing a full case history taking. It must for every single patient. This must be made habit of ask and record a patient's full history before proceeding any further. I have found patients, those who are new to homeopathy, are not used to providing such a detailed information about their illness. Mostly, they are not prepared for it while consulting you. Therefore, I usually give the patient some help to find their answer. For example, for a cough case, I would ask the patient when their cough aggravates. If the patient does not know what exactly I mean, then I ask further at what time their cough is worse. Is it morning or daytime, noon or evening, or in a bed? I would also ask what caused the cough, what aggravates it, and along with what would ameliorate the cough. Each answer provided by the patient would lead to another set of questions, so the correct remedy can be prescribed. Initially, case taking, try to get the answers of basic questions like thirst, appetite, stool, urine, perspiration, menses, and thermals. These are important to get in all cases. However, as your practice grows, you will find need of uh, go to deeper with your questions to our patients in order to truly help them. Finally, the most important and the most hardest part of case taking is the collecting and analyzing the mind symptoms. From my experiences, finding patient's constitutional type first and asking questions accordingly will help. For example, a patient who is of nitromore constitution will look like they are depressed, usually unhappy and frustrated. You will need to confirm the patient's mental state of nitromore, which involves further questioning about their family history and situation, such as how many family members they have in their family and personal situation of their family members. Mostly, someone in the family had either died recently or someone who has been suffering from a long time in their life, like unhappy marriage or daughter. This might cause patient to be in a state of grief, sorrow. All these information will open up the case for you. Even I saw introverts like Nitram Moore also speak up about their mental state. In mind part of case taking, we don't get answer merely by just asking, as we get by asking like thirst, appetite, stool, urine, etc. The most important part of approach you must always keep in mind while prescribing homeopathy medicine to a patient. Your selected remedy will be only work if you follow the teachings of organon of medicine. An example of this is when you are treating a patient for diabetes or thyroid dysfunction, your aim should be always to treat the patient in disease. We don't have any specific medicine for a particular disease state. Take for instance, many of us try treating diabetes with the medicine like Cesium, but it doesn't help the patient. For homeopathy prescribing, you must treat the person and not the disease. You see, in such cases, diabetic patients are usually on allopathic drugs that just to control their increased blood sugar level. In most cases, as the disease state progresses, just oral allopathic drugs will not help to control their blood sugar levels. When this occurs, the allopathy physician will prescribe insulin injections. Usually, at this junction, the patient seek for homeopathic treatment. Therefore, as a homeopath, it is our duty to complete a thorough case taking to find the information about their life situation, and what they are going through. As a homeopath, you must try to find the patient's state of mind by inquiring if the patient has any cares, grief, worry, sorrow, disappointment. There is always a cause behind the disease. When you treat the cause, you help the patient heal completely. I tell you the most important fact that it is just because of result of homeopathy medicine, homeopathy is surviving and developing over the years. I hope sharing my experience will help your case taking and prescribing better. In my next post, I will share with you the questions you needed to ask while case taking. How do we get peculiar characteristics of patients, and how to prescribe accurately. Thank you.